I call upon Dr. Raveendra now. He's going to talk about challenges with scleral patch graft and glaucoma filtration surgery repair.
Thank you. This is mostly a photo essay. We saw this patient in 2021 after the post-COVID era started. Past history of trabeculectomy for angle closure, angle recession glaucoma actually. Now with this type of image, a low IOP, whether it was a trabeculectomy with mitomycin C or whether it was a surgical scleral flap problem, whatever it was, we had to go in for a scleral patch graft, and for some time it reached normal IOP, but what happened is that this fungal ball came in through the wound into the anterior chamber, and vision was decreased, IOP was fluctuating, high and sometimes moderate. Then we had to give intravitreal fluconazole injections, multiple injections had to be given, and these injections had also to be given into the subscleral area, and after multiple injections, vision somewhat improved, but then IOP rise was frequently occurring, rising to 40s and 50s, and the VR surgeons then saw some vitreous haze and advised TPPV and the repetition of the antifungal intravitreal injections. And this is the condition post VR surgery. But then vision rises again, and then we are now, IOP rises again, and then we are now forced to do the tube surgery. This is just 1.5 minutes of the full 40 minutes of the surgery. Some of the steps only highlighted. So finally, the scleral patch graft also is in place, and why does it always occur like this? Yeah. Go to the last slide. And then IOP is currently under control with 3 molecules for the time being and vision improved, but IOP may rise yet again. So the lessons we learned from this case were that the first decision to take up the scleral patch graft may not have been the right thing, maybe a resuturing of the wound and conjunctival dissection and forwarding of the conjunctiva with suturing may have been sufficient. And if at all scleral patch graft has to be used, lot of care has to be taken, and maybe the soaking of the tissue in betadine has to be for a longer time, and probably those 2 things could have prevented, and it is with the aim of highlighting these points that we are presenting this case.
So this case, when you did that valve surgery you did, sir, after that?
Huh?
Tube surgery you did, no?
It was AGV.
Yeah, so you have followed up for how many months after that, sir?
Yeah, right now it is in 3 months follow.
Okay, so
Yeah.
3 AGMs you have?
Yeah, yeah.
Okay, so that was a non-valved implant or what was
No,
put?
AGV.
Okay,
Valved implant.
valved implant was
Ahmed
put.
valve.
Okay, I think it was a low-grade end-off
Yes,
which
yes,
happened
yes,
and,
yes.
okay.
So when did the fungal infection occur? It happened after you put the
After-
first patch graft?
Yes, yes. Almost 8 weeks after the patch graft. We thought that it has improved, and then the fungal infection came, and there was the need for VR intervention.
Thank you, sir.